Hi, and welcome back to It Could Be Your Eyes. Today, we have a very special guest. We have Dr. Eric Chow, and we're so excited to welcome him to It Could Be Your Eyes and talk about his practice. So, Dr. Chow, welcome. Can you share a little bit about yourself and who you are, where you come from, and what your deal is?
Yeah. Well, first of all, thank you so much for the invitation to be part of your guys' podcast. My name is Dr. Eric Chow. I'm a functional optometrist, and I'm the clinical director and owner of Miami Vision Therapy, which is located in Miami, Florida. And my passion is in seeing kids and adults with binocular vision disorders, and just helping patients see their potential.
See your potential. What a fabulous segue. Because we
I
hear
did think long and yeah, no, like see your potential is, a tagline that I've thought of for a long time before, um, like actually putting it in our logo. And, we all hear the term like, let's help people reach their potential. But as functional optometrists and the vision therapy doctors, optometrists, like we know that kids and adults need to see their potential first before they can reach it. So in vision therapy, that's what we do. We help people see, in all aspects of that word. So I'm glad you guys like it.
Yes, exactly. And so with that, with See Your Potential, you have your practice where you're seeing vision therapy patients in office, but now you've actually expanded to offering your services digitally. So can you tell us a bit about that?
Yeah. So the digital therapy program that we've created really just gives us an additional tool to help our patients um, access the care that they need. So this really grew out of patients that would, come into the office, a couple hours drive, some out of state, others out of the country, seeking a very thorough binocular vision evaluation. And, I see the patient and I diagnose them with a binocular vision disorder. And as we all know, traditionally vision therapy is done in office once a week on a weekly basis, and we reevaluate from 10 to 12 weeks at a time. Um, and that wasn't an option for the patients that were traveling from afar. So that really got me thinking into creating a program that's going to cater to those patients. Right? We know what the patient needs, the type of activities and the structure that they need to get better. So how do we provide that option for them so that they can still get the care that they need? So super grateful for you guys, Dr. Collier and Jess and your entire team for helping develop this program. So just want to give you a little shout out there. Yeah.
Thank you. So what you're really saying is the whole delivery model and how vision therapy is delivered. So, vision therapy kind of, I don't know, they say started about like 70 years ago with Dr. Skeffington. And it really was that one-on-one, like hands-on care, like what happens if I put this lens in front of you and like all of those things. And then it developed into this full-on methodology about how the brain controls the visual system and how we take in information through our eyes, but then that translates into how we interact with everything, everyone, every item around us, and how we see the world and how we see our potential. And so now we're moving
Mm-hmm.
into this new age where people can access a lot of information digitally. And so now you've kind of transformed to have there be a digital delivery model of what you do and how you practice available to other people, which is amazing. And so what exactly does
Yeah.
that look like for a patient? How do they even start? Like a lot of the people listening might not know what binocular vision dysfunction means, and what should they be looking for in their lives, and how can your program help them see their potential?
Yeah, so the flagship program that we created is titled Brain Core Training, and it's designed to help patients with general binocular vision skill issues. So namely, trouble focusing. So if a child is looking at a near target and reading a book or doing their homework, for example, and they're complaining that their vision comes in and out of focus. So that's an eye focusing problem. An eye teaming problem. Maybe the child sees double. They see two of something and they might need to cover an eye or tilt their head in order to read. So, those are the signs that we would want to look for. So any abnormal head posture and, closing an eye or like squinting, eye rubbing, those are all things that can point to a binocular vision disorder. And certainly the last piece is oculomotor skills. So that's a tracking issue. So, if you're reading with your child or the child is reading out loud and you're noticing that they're skipping words when reading, skipping lines when reading, those are all signs that's going to point to a binocular vision disorder. And the first step would be to get evaluated by a functional or developmental optometrist, and get that diagnosis first. And now in our office, we have this, alternative way of receiving care, which is digital. And like you said, I mean, like with Skeffington and how it was developed, I think you said 70 years ago, which is kind of crazy. It's so it's been around for a very long time, and it's the truth of the matter is that not a lot of optometrists specialize in vision therapy, and it's really important for those of us who do vision therapy, to pass on the legacy, like pass on this very effective treatment that is so valuable in our profession, and really disseminate it and bring it to the masses, because it helps so many people. It's what a lot of patients are seeking, and so we need to make it accessible, put it in a digital format so people can experience it and benefit from it.
Exactly. We had a patient who came in yesterday, and I think that you would find this interesting. She was 15 and she was referred by her eye doctor because they couldn't get her to see 2020. And they're like, you know what? Something's not right here. Let's just send her to Juanita. Like, okay, thanks.
That's what happens. We just catch them up.
So then we asked her, like, why are you here? And she's like, oh, because I can't see. And it's like, well, actually, you're right. You're 20/40 for distance. You're 20/50 for near. You're 15. None of that is acceptable. You're wearing your brand new glasses. And as we're going through her exam, I'm like, oh, so you see double when you read. And she's like, oh, yeah, that's been going on since 8th grade. Okay. And then we're doing more of your exam. I'm like, oh, so you see double when you see distance too? Oh, yeah, that's been going on since, like, I don't know, 7th grade. Okay. I'm like, who have you told about this? Like, nobody?
Right.
And that's the thing. So, her step parent that was there with her was in shock. Like, why didn't you say anything? But she was like, I just thought that that's how I see. And I just know I can't see. And so that's what I've been telling you guys. I can't see. But what sort of questions would you probe parents to ask? Because, we have so many parents who are listening to us right now. What questions could her parents have asked her? Now she's a sophomore in high school. She's been noticing this since 7th, 8th grade. And she come to find out she had a concussion in 6th grade and then another concussion in 7th grade. So that makes sense. But they didn't think about her vision issues and not being able to see, whatever that means, came from those concussions, and that they never actually resolved. So what sort of things could parents look out for, and what should they even ask their kids?
Yeah, that's a good question. I would say just be curious about your child. Ask what and how questions, right? Ask, okay, how is your vision? Like, what type of issues are you having when you're reading? Or if the child just doesn't like to read, right? Let's investigate further. Let's probe. Let's be curious about why the child doesn't like to read. It could be the content of the material, but it could be physically taxing for that child to sustain focus, and clarity and keeping track of what they're reading, right? It could be, like you said, double vision. They could be seeing two. Who likes to read when they're seeing two of something? Who likes to read when the image comes in and out of focus and it resets every time they blink? So I think being curious and in terms of noticing behaviors, like if you notice the child is not, like I said, having good posture, or they're constantly turning their head and moving, and the working distance, they get really close and then really far. They could be just trying to reset their visual system in a more comfortable position. And the beauty is, vision therapy can help with all of that. We can train the brain how to use the eyes more effectively. Um, and your story is so cool because we see kids like this all the time in our office, and it just reinvigorates those of us who do what we do in pediatric optometry, that a lot of these kids don't know what they're supposed to see, how they're supposed to see. So that just means that we are in a very important position as healthcare providers to change the trajectory of that child's life. Kids may internalize things, right? Like, that child maybe thought everyone else saw like she does with double, and so didn't decide to tell, her stepmom. So being able to, diagnose it and find, be more aware of the signs and symptoms to look for is critical. So yeah, I think just being curious and asking what and how questions for your kids is critical.
And then also for those parents, usually they're not coming to us as their first stop. Like, if their child says that they're not seeing well, a lot of times it's the pediatrician that they're going to first, and then a general eye doctor. They're not usually coming to us as specialists first. And so, what sort of questions would you suggest they ask their eye doctor or even their pediatrician? Because when her stepmother was shocked, but like the little girl, 15 years old. I guess I'm old by calling her a little girl. My goodness, time flies. My peer, the teenager. Yes. She wasn't shocked that she was seeing double, but she didn't know that that was a thing to even verbalize. And so, what sort of things could those parents ask the eye doctor that they're seeing? Because she's been going for eye exams her whole life, she has glasses, but she didn't even know what to even ask. So where should they start with that? If they were going to ask 3 questions, what would you suggest?
Oh yeah, that's a really good question. And like, I think it boils down to, not all optometrists are going to assess the same things, right? And that's just, across the board. Like, we all graduate from optometry school, we are all trained to see kids and adults and treat XYZ eye diseases. But when you graduate, you kind of pick a passion. And for us, it was pediatrics and vision therapy. So we're just more in tune of doing all the testing that will pick up these issues. So if a parent goes to an eye doctor that maybe doesn't have a passion in pediatrics or pediatrics and vision therapy, they might not be doing the appropriate testing. So this is when we have to be advocates for our own child, be advocates for ourselves if we're the patients. The 3 questions I would ask is, at the conclusion of the exam, ask the eye doctor, how was my child's eye focusing ability? How was my child's eye teaming ability? And how was my child's eye tracking ability? Right? So if we ask these questions, it's gonna, you know, remind the doctor. It's gonna, ask, really get them to think, like, really, well, how were the eyes moving? How were the eyes focusing? And how were the eyes teaming? And whether he or she did the screening and the testing required to accurately answer those questions. And fortunately, hopefully, if those tests weren't being done, those 3 questions would be enough to make the proper referrals to a functional optometrist who will dig deeper. I love that question because it's encouraging people to be advocates for themselves and their child.
That's awesome. Exactly. And then your program is for slightly older patients who might, have a little bit more skin in the game, like that, like 10 to 14-year-old patient who, they actually need to be motivated to do the exercises. It's not just like your parent can't just tell you what to do anymore at that age. And my daughter just turned 10,
Yeah.
and pray for me. But so how does
Good
your
luck.
program, get those kiddos to participate? Because a lot of times at that age, the parents can only do what they can do. So how's your program different in that the child's actually going to want to do it?
Yeah, I mean, like twofold here. I guess as we're developing more digital programs, um, it would be for different groups and or specific diagnoses in patients, and also just um, different interests groups, if I may, if that's the right way of saying things. But more or less, there's a portion of patient selection that goes into it, right? So if I see a patient and I can tell that they're super responsible and they're very self-motivated and can more or less be independent and be in front of a computer and watch the series of very detailed instructional videos on how to do certain exercises, then certainly they'll be a good candidate for this program. And the other piece to our program is we also incorporate computerized games
Kids love
that
that. Kids
yeah.
love that.
And it's also kind of like built in where the level of the activity and the level of the game gets harder and harder as you go. So there's ability to kind of track their own progress. So yeah, I mean, I think that's a really important thing as we continue to build these programs in mind. Like, how do we make it fun? Like, how do we gamify it? And because we know that I think there's some statistic I read that if doing activities that are in a gamified way, just fires more neural pathways compared to if you're not enjoying yourself, like not having fun. So we try to definitely incorporate that not only in the digital program but also in our in-office program as well.
Exactly. We kind of have to spark that inner competitive nature.
Yes. Mm-hmm.
It's like beat your
Yeah.
own score, beat somebody else's score, just beat something so that you'll continue practicing.
Yeah. Exactly.
So when they do these kinds of things, what kinds of changes could they expect to experience after doing, being motivated, showing up, playing the games? What kinds of changes in their lives should your clients and patients expect?
Yeah, so improvements in reading endurance, the ability to sustain focus for longer periods of time when they're engaged in near work, um, reduce time to complete homework because now their visual system is a lot more efficient and it's able to gather information for processing a lot more quicker and more efficiently. And we've seen kids develop a joy of reading. Patients that come in that initially just hates to read, wouldn't pick up a book to read for pleasure. To when they finish the program, parents saying, you can't get them to not pick up a book. Like, you're constantly seeing the child like reading and being voracious readers and actually enjoying what they're reading. And I think just developing, being more aware and being more engaged in their environments, being interested in sports and being more social and like hanging out with friends and, being, again, just being more engaged with their environment, because vision is so integral to everything, right? I think the statistic is 80% of learning happens through the visual system. So it just makes sense, if we're able to improve visual skills, that it's more efficient and it's easier for them to engage with their environment. It's easier for them to trust their environment. And so just, yeah, we see all of those changes, in our vision therapy patients.
And then with that, and then being able to kind of like gamify things and having it be instructional videos and everything, you can find essentially anything on YouTube. And so why would a parent, steer toward your program as opposed to kind of just like doing some exercises that they found online
DIY.
for like binocular vision dysfunction, or, doing like perceptual games, or even like some vision therapy apps and things like that. Why is this different?
Yeah, so there's absolutely a lot of new technologies out there that train visual skills. In addition to YouTube, like you said, you can look up how to do a Brock string or how to do an eye chart exercise XYZ. But the issue with that is like I think it first starts with getting a proper diagnosis of what skills are actually in deficit, right? Like you don't want to be training the wrong skill, or like take or like a fire hose approach and just treat everything, because you might be training the wrong thing. Okay, you might be overtraining a particular skill, and as a result, something else suffers in the visual system. So um, I think what makes our program unique is, um, we really spend a lot of time, my team and I, to think of what we currently do in the office, and really distilling it to a grid pattern. So there's 6 modules in our vision therapy flagship program, the digital program, and each module is 2 weeks long. And so each week builds on the foundational skills that are taught from the week before. So it's very structured, and it's tested. From our experience, I've been doing this, I guess, for 10 years now. I graduated 2016, which is crazy. So just kind of using our entire database of patients, and trial and error, being able to just distill what worked in our office and just putting it into a digitized format. So highly encourage that, wherever you are, it's really important to see a functional optometrist first, to first get the diagnosis, so you can have some clarity at what type of issues you have to begin with, before
Get
you
clarity,
play
but
around with YouTube. Yeah. Oh yeah.
Oh, Jessica.
Love it.
I couldn't resist.
And so what you're saying is essentially this is a way for people who might not have the ability to see you on a frequent basis or anything like that to still get all of the knowledge that you've amassed over the past, 14 years, because you were in school as well,
Yeah.
and really be able to
Mm-hmm.
still benefit from all of that knowledge that you yourself provide. And they can get it digitally. They can get it from the comfort of their home. They can still benefit from all of your knowledge and transform
Yep.
their lives in such a big way with your help. That's amazing.
Yeah. It's pretty cool. I just wish I started this process earlier with you guys.
I mean, but it's also just kind of what's next, right? I think that's, we started our digital program. What is it now? Like 6 years ago, 5, 6
like,
years.
Yeah, like 4.5 years ago. Yeah.
Whatever. It feels like forever ago. But
she loves me. She promises.
But we had to
I
do a
can see
lot
the
of trial
love.
and error. We had to do a lot
Yeah.
of trial and error, and we had to kind of figure it out. And I think, like, being able to see what other doctors are doing, in this space is really showing us what's next in the field of vision therapy. And it's kind of like really exciting to see how the field has grown. And we hear it from
Yeah.
patients, and especially parents, like, all the time. Well, this wasn't around when I was a kid. Well, it was, like we said, vision therapy has
Exactly.
been around for
Yeah.
forever. Well, not forever, but for a
Yeah.
long time. It's just that it wasn't accessible. It was a very well kept secret. It was a very inaccessible thing for, like,
The
honestly,
uber wealthy.
Yeah.
Yeah.
the uber wealthy, the people who could
Mm.
actually get access to it. That's not what we're doing here. We want accessibility. We want people to be able to benefit. And so I think that's, like, what you know, brought to us too, is that, you know, there are people who are coming from all over the world to see you and you seek out your expertise. So then how do we make this available to them? So with all of that being said, what is going on, or that you see, because you also, you know, you talk to a lot of other optometrists and eye care professionals. We see you traveling and talking and lecturing, and you are like, you
a big
know,
deal.
yeah, you're a big deal, dude. So what do
Thank
you
you.
see?
No, I love it.
Yeah. What do you see as like the future of vision therapy, and what are you excited about seeing grow within this field?
Ooh, I love this question. Okay, so I think that with the advent of like ChatGPT and just accessibility to more knowledge to everyone, right? To doctors, to lay people, to other professionals. It's just going to be a matter of time until more and more people know and learn about vision therapy. Like, for example, like the days of a parent going to an ophthalmologist or an optometrist, and the child is diagnosed as having lazy eye, and the doctor says, okay, your only option, or just recommends patching without furthering the explanation and other treatment options, etc. Those days are going to be limited.
Yes.
And parents and patients are going to Google. They're going to search on ChatGPT and other AI platforms and seek alternative solutions. Okay, so that's really exciting because it's going to really shed light on um, those of us who specialize in this field and are thought leaders in this field, who have really dedicated their time and energy, because it is a lot of time and energy to really be on top of the newest research that comes out in our field. And it's an exciting thing because back to what Juanita was saying, like it's all about we like and Jess too, like your guys' mission is to bring vision therapy and help as many people as possible, which is what resonated with me so much. And so it's really exciting to see that this kind of newfound interest is going to be so rampant, and it's just going to exponentially get bigger and bigger. And back to the neurology of vision, right? Like 80% of learning happens through the visual system. If you look into our cranial nerves, we have 12 cranial nerves that dictate body function. At least 75%, so at least 9 of those cranial nerves either directly or indirectly affects visual function, if you think about it. So that's a huge amount. That's 75% of the brain, of the body, is dedicated to this important sense of vision. And as we all know, vision, the purpose of vision is to direct motor behavior and, make us feel safe in our environment. So a lot of different professions, I think, are going to start noticing and realizing the importance of vision. In the area of traumatic brain injury, if you get a concussion, you're very likely, I think the stats are like 90%, that you'll get some sort of visual issue. And we're not talking about eyesight, right? It's all the other skills like the eye focusing, eye teaming, and eye tracking ability, just to name a few. In terms of the diagnosis of a concussion, but also in terms of treatment and rehabilitation. Um, and that's just in the area of like neuro rehab. And then there's a lot of research into pupillary function, like how is the pupil affected, in variety of acquired and traumatic brain injuries, and can we detect a concussion, looking at these visual skills, and who best to assess these skills than optometrists who specialize in binocular vision and visual processing and the neurooptometry aspect of things. So and one more thing would be technology. Like I said earlier, there's a lot of new games and you know that treat amblyopia, right? That are FDA approved. So there's a lot of market research and financial funneling that are starting to really go into the eye care space. Within our field. So I think with that, more and more people are going to be curious and start asking like, how can we improve our visual skills? And to be able to offer a digital program just makes it that much more accessible to everyone. So I would say like I'm really excited. Just and my mission is just to continue to spread awareness about vision and vision disorders, and highlight the amazing work that we do as optometrists who specialize in vision therapy.
And I think that you're so right with like chat GPT and perplexity and all of those things. I think that one of the main things that's going to be happening in the very, very, very near future is that patients and parents, they're going to understand that vision means like that 2020 is such a minuscule part of vision. And once they realize how much vision actually impacts, then that's going to transform everything. And vision therapy is going to be essentially the only answer. So having it be an accessible answer is what we really want, because vision therapy has been a solution for so long, but to such a small number of people. And now we're making it that it's a solution to everybody. And that's why we're here.
Yeah.
Yeah, I love it.
Well, thank you so much for joining us. We can't wait to hear about all of the success that comes with your patients that are able to do your program. Can you go through it one more time? Tell us the name of your program and where people can find you.
Yeah, certainly. So the name of my program is called See Your Potential Brain Core Training, and it's a 12-week digital vision therapy program that can be accessible to the patients who need it after an initial evaluation with us. You guys can find me on my website, miamivt.com. So Miami and then V as in Victor, T as in therapy.com. And we're also on Instagram and Facebook and TikTok as well. So find us there.
TikTok, look at you.
We've dipped our toe, but we're kind of not really TikTokers.
Yeah, we're not very good at it. We tried.
I think you guys will be great with it. Yeah.
One day.
Try it out.
Yeah. Well, thank you again so much for joining us. This was great. We'll put all of your information in the show notes. And please follow Dr. Chow because he's doing some amazing things out there. Thanks again.
Awesome. Thank you guys so much.